Welcome to H&HN Daily. I'm Susanna Hopsollen, Senior Editor for Hospitals and Health Networks magazine. The end game of the electronic health record is better patient outcomes and a healthier population by using resources more efficiently and where they're needed. The New Ulm Project is a nationally recognized population health initiative to prevent the occurrence of heart attacks. Today, I'm joined by Toby Freier, President of New Ulm Medical Center in Minnesota, to discuss their population health initiative. Welcome, Toby. Thanks for joining us today.
Thanks for having me, Susanna.
Toby, you have a bold vision of being the national model for rural health. What are the strategic pillars that underlie this vision?
Well, Susanna, first, I think we want to recognize that I don't know that there's going to be one model for rural health across our country. Given how diverse our communities are and the populations we serve, I think we're going to have to find many different models. We are interested in being a national model for rural health. And I think it's important because we feel like we owe it to our community and the people that we serve, that we want to offer some of the highest value healthcare and health promotion and health partnership anywhere in the country. And we feel like we're in a position to have that bold, desired future state because of the work that's been done over the last 15 to 20 years. And it starts with integration. And this moves beyond just thinking of our physicians around partnership and integration, but all clinical services that we possibly can integrate in ways to share resources, share information, and how we basically come up with one rural health plan for the community for all caregivers and all individuals that are responsible for the health of a community. The second pillar that we feel is really important is the use of electronic health records. And it's not so much the use, it's how we turn data into information and information into a decision-making tool, both for a physician and a patient. And the third is community engagement. When we start to move from being a provider of illness care or reactive as a healthcare system to want to be proactive and partner with our community, we're not going to be able to do this on our own. If we're interested in improving the health of our communities, it will take the engagement of our community. We're not going to be in a position of controlling or even having the resources to do this. So what we're wanting to do is really engage a community and all of the leaders across the community. What can their role be? They have a shared interest in improving health.
You have a work plan that has very specific measures and goals for patients with chronic illness. How are you dealing with that non-compliant patient, and how do you overcome the objections that you hear from clinicians? I'm doing my part, but what about the patient?
Well, I think we're in the same position as everybody else around the country. It's a challenging time to be a physician and to be a caregiver with the expectations that are being put on our healthcare system. And I think what we try to realize in New Ulm is we're not ultimately in control. We need to be a partner with our patients in our community. And we need to be in a position of influence with our patients. And the other thing is, this isn't just about our physicians. We need to support our physicians with a team of caregivers and other support staff that can help, from health coaches to social workers, because, when we talk about non-compliance from patients, what are we doing to learn around why non-compliance or why they're not at the goal that we have for them? Do they have that same goal? And I think once we start to identify barriers, we're going to much better understand how we can help with non-compliance issues. So it may be the cost of care or medication. It may be access to a provider that is a barrier. It may even be a health literacy issue of not understanding the complications that their disease presents to them. And I think those are all opportunities for us across the healthcare system to improve and not shy away from being accountable for outcomes, but actually engage our patients in a new way.
Can you tell us, how do you use a population health dashboard?
The dashboard is key because it's the gauge that helps us understand where to plan interventions, what we can do in response to the needs of the community, and then is it working? And to not have to rely on 2-year-old data to not have to rely on survey data or a payer willing to partner with us to provide certain data, to say in 4 hours, I would like to be able to refresh our dashboard report or look at how we're doing on weight management within the community. We're now able to do that through our population health dashboard or our electronic health record.
Are you actually sharing it with the community?
We have been very transparent of the health of our community from day one. And so I think that's helped with engagement.
The entire community is focused on reducing heart attacks. What can you share from your experience on how to engage the community?
What's worked for us is to involve the community, ask them to be involved, have them provide input, have them make decisions about the project, have roles for them of what can they do to do their part in helping with the goal of reducing heart attacks and ultimately improving the health of the community.
Thanks for joining me today.
Well, thank you.